Welcome back, everyone. Today, we are joined by Dr. Darlene Weyer, Medical Director of Lima Memorial Women's Health Center. She's going to discuss a critical topic in breast health, dense breast tissue, and how new advancements are helping early cancer detection. So thank you so much for being here, Dr. Weyer.
Thank you, Chris. Thank you for having me.
Yeah, so to start, can you help our viewers understand what dense breast tissue is and why it even matters?
Yes, dense breast tissue is the amount of fibroglandular tissue in the breast compared to the amount of fat. So the more fibroglandular tissue a patient has, the more dense her breast tissue will be. And that dense breast tissue is white. And the more white tissue there is on the mammogram, the more difficult it is for the physician to detect breast cancers because all breast cancers are white on a mammogram. So the more white tissue we have, the easier it is to potentially miss a cancer.
Yeah, so that's really helpful to know. So how does having dense breast tissue impact a woman's breast cancer risk?
It increases her breast cancer risk. The more dense the breast tissue is, the greater risk the patient is at developing breast cancer. We don't completely understand the full the reasons behind that, but we do see a much higher incidence of patients who have the dense breast tissue developing breast cancer.
Yeah, so that's where advanced technology like the ABUS 2.0 comes in. So can you tell us about the ABUS 2.0 and how it helps?
Yes, the ABUS is basically, it stands for Automated Breast Ultrasound, and it adds additional information. It gives the radiologist more information to zone in on areas that are really dense within the breast to be sure that there's no mass hidden within that dense breast tissue. It's really important to understand that the ABUS does not replace mammography. Mammography is still the gold standard for detecting breast cancer. But the ABUS is an additional tool that we utilize in patients who do have dense breast tissue to zone through those areas that are dense to see if there's anything hidden. Because all cancers on an ultrasound are a shade of gray. So if a patient has all that white dense breast tissue, it's easier to see that gray cancer pop out. So when we add both of those tools together, the detection rate is much greater.
All right, so if someone's interested in learning more about an ABUS 2.0 screening and maybe if it's even right for them, what are their next steps?
Their next steps are they can talk to their primary care physician or the referring physician. All patients that do come into the medical park for a screening mammogram, if they do meet criteria, our staff is trained to talk with the patient, explain to them what the ABUS is, the benefits of the ABUS, and then if the patient does decide that she wants to have it done, we reach out to her physician to get an order, and then we go ahead and do the ABUS exam.
All right, fantastic. Well, thank you so much for joining us today. I really appreciate it.
Thank you, Chris. Thank you for having me.
All right, well, don't go away because we have more to return.